Hey there, YouTube. I wanted to talk a little bit about premature and forced retraction of the intact foreskin. Premature and forced retraction are actually two different things, and I've seen a lot of differing information in different places on the web, and I just wanted to post some intact care for the record. I wrote it out, so here I go reading. The bonding membrane between the foreskin and the glans, which is the head of the penis, is called synechia or preputial lamina. It needs to naturally separate before the foreskin can retract. This can happen anytime, even after puberty. Retraction prior to this time is forced. It tears this membrane and causes many issues like infection, bleeding, adhesions, scarring, and phimosis, which is where the foreskin no longer will retract. Not to mention the boy having anxiety or worse in regard to his penis, so this should never be done. Never. What I've seen a lot is that some people feel that hygiene is still so important that whenever this natural separation finally occurs, they believe it's necessary then to retract themselves or teach the boy to retract and clean under the foreskin. Here's the thing about that. The ridged band is elastic tissue that makes the opening of the foreskin narrow and helps it do its job by not letting anything in there. Yet it can still open for the glans. This needs time to mature, just like the preputial lamina needs time to mature and dissolve. It goes through a change from being muscular tissue that really holds tight and keeps the foreskin from retracting very much to being a more elastic tissue that readily expands. Just because the synechia, that bonding membrane, is released and dissolved doesn't mean that the ridged band, the end of the foreskin, is ready to be constantly expanded. Children's bodies grow in a pretty sporadic way, and all of the parts as they're growing change in size relative to each other. You know how you went through awkward stages as a kid and your ears were bigger than your head, that kind of thing. And then you grow into your various parts and everything looks normal again. The foreskin and the penis can go through this too. So at some stages the foreskin is tighter and sometimes it's looser. So what this means is that by premature retraction, you still risk overstretching the ridged bands, which can still cause some minute scarring and possibly later phimosis, the non-retractability, without even knowing it. If the boy is instructed to retract rather than finding it out himself, which personally I think is a little sad because he's being denied sort of a personal discovery about his body, then he may cause himself to get paraphimosis. Paraphimosis is when the foreskin gets stuck in the retracted position behind the head of the penis, which can be painful and can even cut off blood supply and cause other problems and become an emergency. He may start retracting when his foreskin is looser, and because he was instructed to do it, he'll do it when it's tighter, as opposed to only doing it when nature tells him to. Puberty takes care of the penis with a lot of hormones, which help in the penile development and skin elasticity, and the urge to stretch the foreskin on a pretty regular basis, which will probably be done in the shower anyway. Until puberty, there is really nothing going on under the healthy foreskin that needs to be dealt with. If you instruct your child, like you would with a girl, to wash hands after touching the bum or the mouth, and before touching the genitals or the mouth, the rest should take care of itself. Cut down on sugar and soaps if there is an irritation, and deal with the problem if it comes up. Trust nature. There is such a thing as too much prevention. So remember, only clean what is seen, and let the boy be the one to retract his foreskin. You'll avoid a lot of problems. Thanks for watching.